All right, hi, I'm Elmira Young. So as Dr. Flowers mentioned, I'm an endocrinologist here. My specialty, as you heard, endocrinology. So it's dealing with hormones. Anybody has any ideas about what hormones are? Yeah, pretty good. Awesome. So diseases that we manage includes diabetes, thyroid disorders, adrenal problems, weight, which is a hot topic nowadays. So those are the couple of the things that we manage here. So what take me to go into this field? So from growing up, I actually didn't want to be a physician because I saw my dad who worked so hard back then, long hours in the past. So I didn't think about going to medicine first, but I did have my interest in biology. So I was doing bioscience, and but as we go through those courses, I got into physiology. I was interested in that, and then I was doing other volunteer work, get to know medicine when you're the providers, from rather than from a family member's perspective, looking at the provider's life. So it's very into intelligence challenging. So every day I feel that I have things I need to learn, which stimulates my brain, and I like. So that's why gradually I changed my career path. My educational journey. So as I mentioned earlier, I didn't think about being a doctor initially. So after getting my degree from a college in Taiwan, I actually worked for a little bit as a research assistant, and then attended some pre-med courses and eventually applied for med school. And then as Dr. Flowers mentioned, for internal medicine, the training is 3 years after graduating from medical college, medical school, and then 2 more years for fellowship, typically for endocrinology. Different specialties will have different length of training. And what do I enjoy the most about my work? So, like I mentioned, there's a lot of things to learn every day, which is very stimulating, and I like it. And especially here, working with our patient population, I frequently feel rewarded from working with them, and they taught me different things as well. So I really enjoy here. What would I say to my younger self? I'll tell myself, hey, the path you choose is not easy for sure, but you will learn a lot throughout the way, and try to experience as much as you can, even though it may not be the ultimate thing that you want to be, but you can learn from what other people are doing, and then take them as nutrition for you to grow. Thank you.
So, mention Dr. Clark. Dr. Clark's here. She's our pediatrician. Dr. Clark, to let you know, we have high school students from across Riverside County. They're not all from the same high school.
Perfect.
And we have 10th, 11th, and 12th graders.
Awesome.
And we have several in the room who are considered peds and a few that are considered pediatric surgery.
Very
so
exciting.
they're really kind of want to absorb from you as you're kind of presenting something.
Awesome. Well, can you guys hear me without the microphone?
And they want that mainly
for the movie. Okay. All right. I hate microphones. I'm super loud. Yeah. Hi, everybody. I'm Aleka Clark. I am a pediatric hospitalist. So that actually means that I care for children when they are at their sickest, lowest point, when they have to be hospitalized for some illness or injury. In the early part of my career, I did have an outpatient clinic, so I took care of everyone as they came just like to our clinic for their regular checkups and their regular sick visits, but now all of my work is on the inpatient side, and that's primarily because I hold a second title or administrative role as the Chief Medical Officer here at Riverside University Health System. So it is you're very capable in careers in healthcare of blending different passions you might have. So some of us love just the day-to-day bedside clinical, and that's awesome. And others of us, like Dr. Flowers and myself and others, we do some clinical work and we do some administrative work, meaning how do we drive process or improve access to care? How do we look at policies? How do we help our teams provide what's best for our patients? And so I have that blended role, which is a little bit different than someone who might just be going to clinic every day, and that's okay because they're all different. Every person is required for a health system to actually operate and functional. So those are kind of my roles and what I do. Why did I choose pediatrics? Let's be honest, sorry for those of you that aren't choosing peds. Peds is way more fun. Way more fun than adults. No, I love my adult colleagues and I need them to be good because I'm obviously an adult. I can't go to a pediatrician anymore. But you know, there is a beauty and a joy to helping someone who is at the start part of their life, getting them healthy, getting them back on the road, keeping them healthy, seeing their success. It's super rewarding for me. I actually just this week got an announcement in the mail for someone that I cared for on the first day she was born and took care of her through her early childhood, and she's graduating from college. And to receive these like announcements or birth announcements or wedding announcements from people that were maybe even on death's door when I first took care of them to now achieving life success, that's a meaningful thing for me. And that speaks to me. And so I love making an impact in our youngest patients, trying to keep them healthy, get them healthy, teach them life skills. You all are at a really critical junction in your life because you're on this young adulthood journey of making decisions for yourself, choosing wisely who to associate with, what to do. And that doesn't just include your academics, but your friend circle and activities. I can't tell you how heartbreaking it is for me to see a young person make one decision. I'm gonna ride in the back of a car at 60 miles an hour and go flinging out the side of it, and now I have a traumatic brain injury and I'll never walk again. Like, just sometimes these things you guys don't necessarily process forward, but it's the thing I want you to really think about. How will this decision today potentially risk or impact my long-term well-being and what I want to achieve and accomplish? So I love pediatrics for so many reasons. Similar to everyone else, you have to go to college and get your bachelor's degree. It kind of doesn't matter what you get it in. I mean, if you get it in interpretive dance, you still have to take a whole bunch of science classes, so choose, wisely from that perspective. But we have communication majors and poli-sci majors and math majors and history majors in medicine. It makes for a richer community, so it's great to major in whatever is interesting to you, even if you're also interested in science. And then, of course, medical school, which is a 4-year journey. Pediatrics is a 3-year residency, and if I had chosen a pediatric subspecialty, that would be an additional 3 years on top of that. When I finished, there was no such thing as a pediatric hospitalist fellowship, so I am not fellowship trained. I'm what's called grandfathered in because I've done the work for so long. But there is now a fellowship for pediatric hospitalists, but it's only 2 years in addition. So where's that? In addition to that, there's other things outside of medicine. A lot of physicians get their master's in business or master's in healthcare or master's in public health if it blends or mixes with their passions or what they want to do. So that's true for many people you'll meet in healthcare. So they might not only have their doctorate in medicine, they might have the master's in some other thing. I enjoy most about my work is interacting with all of you guys. You're the teenagers and young adults that come in have a special place in my heart just because I love seeing those decisions you guys are making, those places you're at as you're wrestling with what do I want to do for the rest of my life. And I'll just tell you, okay, it's okay if that changes, all right? What I want you to do is have a plan. Have a plan and work towards it. Some of you might choose to go to trade school. That's okay. Some of you might choose to join our military. That's great. Or fire and public safety things like police. That's wonderful. You may start one path and zig to another path, and that's okay too. Give yourself grace about that, but have a path, right? Don't have no path. That's where you don't succeed. So we want to have a path. So I love working with young adults like yourselves. What would I tell my younger self? There will, no matter what career you choose, be difficult moments or difficult days. But there will be beautiful moments and beautiful days. And that's true in your life now. Right? And I think we live in an American culture where we tend to focus on negativity. And we think about things like, oh, it was so hard, or that person is so unfair or so mean. Instead, if we can pivot our mindset to think about focusing on the beautiful moments or the beautiful days. I had a really long shift today, but I did it with Dr. Flowers, and he's such a good team member, and we got through it, and we really helped a lot of people, is a different mindset than saying, it was terrible on my shift today, there were so many sick people, right? And if you can pivot your mindset now, in your age range, this will serve you for the rest of your life to give yourself joy and meaning in whatever career path you choose, whether it's healthcare or something else. It'll actually help you live longer, because we know that people that are intentional about practicing gratitude and choosing joy live healthier and happier lives. And who wants to be bummed when you could be happy, right? That does not discount that there will be hard things each of you will endure. That will happen, and I'm sorry for that. It can be painful, some of the things you endure. But you're capable and strong of overcoming them. And it's about choosing the right mindset and choosing the right people to walk that path with you. And I think you're all really very capable of doing that. I'm super thrilled that you chose to be here today and excited to learn more about you as we go forward.
Excellent. So, Dr. Ramos and I are going to be staying a bit longer, but Dr. Clark and Dr. Yang have to leave it. So we're going to ask them a couple of questions and then let them go ahead. So, for Dr. Clark, tell us a little bit about being the NICU, the babies, the ones that are like when maybe a pediatrician might even start even in the delivery room. Yeah. So some of that.
Absolutely. So does everyone know the term NICU? That is neonatal intensive care unit, and that's where our firstborn babies, sickest of the sick babies, go to get their care. And they could need to go there because they are born premature. We can now keep many babies alive who are born at 24 weeks of gestation when 40 is the normal. So that is just barely over half the amount of time they're supposed to be developing in mom's womb. Or they could have a congenital anomaly, a birth defect, whether that be a heart defect or something else that keeps them in the NICU. So as a pediatrician, yes, we'll see those babies immediately after birth, right in the newborn nursery, or if it's a known challenge with the baby, a known thing that we found on ultrasound, then our neonatology team. And that's a group of people who, after their pediatric residency, like myself, they did 3 more years in training specific to caring for the sickest of the infant babies. So that's a 3-year fellowship in NICU. And this is a place where the pathology is very broad. So again, you might be taking care of a baby who literally will fit in the palm of your hand, that can be born at just barely over 1 pound with translucent skin, like only partially developed organs, and then our teams in the NICU can often do wonderful things to help that family keep that baby alive, achieve success. So anybody have premature infants in their family? You have a few people have some premature infants in their family. It's a tough journey if your baby's born premature, right? And so the other wonderful thing about the NICU is that it's not just about caring for that baby, it's really about caring for the family, the parents too, and helping them understand and go through their fears and work through it. But if you are interested in caring for things that can literally fit in the palm of your hand or bigger and see them grow up to be successful, NICU is a great place.
Excellent.
And very procedure oriented, so if you like to do hands-on stuff, procedures, there's a lot of procedures in the NICU too.
Excellent. And then Dr. Clark, you mentioned, and we haven't talked that much about it, but tell us a little bit about pediatric subspecialties. You mentioned about it if you want to do it, but maybe explain how that can be expanded too from pediatrician.
Sure. So just like you think about, I have to go to a cardiologist, or I have to go to an endocrinologist, or I have to go to any medical specialty, in pediatrics, the same exists in parallel with the adult teams. So there are pediatric cardiologists, there are adult cardiologists. There are pediatric endocrinologists, there are adult endocrinologists. And so if you are really passionate about a particular type of medicine specialty, but you love children, then you would choose pediatric residency and do your fellowship in that subspecialty. If you are more interested in a little bit different type of pathology, adult pathology and children's pathology is different. There's a lot more complexity in adult medicine from the perspective of, and you have to give all the kudos to our adult teams for this, adults tend to have more diagnoses, more multiple things that could impact the same thing that our subspecialists are doing. In children, most of them don't have quite as many things, and it's a little bit more of a cleaner path, I would say. Less medical secondary complications, less medicines that are compounding that they have to think about. But if you really are, like I love cardiology. I think like the heart is a beautiful thing and it's logical to me and I really love it. I didn't love it more than general pediatrics, so I didn't choose a fellowship. But you know, I love children, but I love those two things so much that I wanted to dedicate my career to children with heart defects and heart problems. I could have chose that. And then in addition to that, Dr. Flowers, pediatric subspecialists like adult subspecialists, some of them are very procedure oriented. So for you can be a pediatric cardiologist, or you can be a pediatric cardiac interventionalist, where you're the specialist who's taking these children to the catheter lab, fixing holes in their heart, fixing you know, valve problems, doing all sorts of different things. And so there is so much variety. That's one thing I want you to hear from us today is within healthcare, there is so many different options for you that you can explore.
Excellent. And Dr. Clark, maybe you can explain, why are pediatricians so passionate about immunizations?
Oh, yeah. So everyone had to study Jonas Salk that's already taken like Bio 1 or something, right, in high school, and who's, you know, largely credited with the polio vaccine, although his whole team is actually the one who should be credited for that. But prior to the invention of vaccines, the numbers of thousands of children, young adults, and adults we lost to disease that are preventable is staggering, actually, if you look at the numbers. Even in my career, when I started 25 years ago, Haemophilus influenza type B, which is a type of bacteria, had just recently had a vaccine developed. And prior to the development of this vaccine, during the fall and winter seasons, probably in every ER in America, we lost 2 to 3 children a week from this bacterial disease. After the invention of this vaccine and children receiving this vaccine, we maybe lose 1 or 2 children a year in our nation, because who we usually use is people that have chosen to not vaccinate. So there's very few people who don't respond well to vaccines, meaning they don't develop immunity. So if you are vaccinated, that's the best thing that you can do to prevent your, vaccine preventable disease. And you know, I'm very passionate about it. And I know that many people are nervous about what's in a vaccine, and there's a lot of mistruths out there. So just like all of you are on social media looking at things, whether it's related to, you know, vaccines or some other element, please check your sources. Don't believe everything you read. That's not true, right? Make sure you're going to reliable sources. Trusting someone who's a celebrity about what they say about vaccines versus trusting someone who's studied vaccine science for 25 years is 2 very different knowledge bases. So let's think about who we choose to believe for our sources. And then I would say, which one of you, when the newest iPhone or Android phone came out, thought, maybe I shouldn't get that because there's new technology in it I don't understand? Did that thought cross anyone's mind? Did anyone say, I don't want to line up for the newest iPhone because there might be technology in it I don't understand? Do you understand all the technology in your phones? No, but you accept it. So let's try to be thoughtful and rational about the things we choose to accept or not accept.
Very thought-provoking. That's excellent. Thank you, Dr. Clark. And we know you've got so we don't want to hold you. If you're welcome to stay.
I'm going to listen.
So for Dr. Yang, so Dr. Yang, we talked about internal medicine for years, and then you had several pathways you could consider. How did you consider endocrinology? What made you make that choice?
Well, so just like Dr. Clark mentioned, there are some specialties that are more procedure heavy, and some others are not as procedure heavy. And for me, compared to doing procedures, I'd rather not do procedures a lot of times. So, and endocrinology is a very a specialty where you have to think through things a lot of times. So, and I do have a few family members who have different endocrine diseases. So from early on, I got to know those diseases through reading, talking to my family members, and so I like this particular specialty, and I think I enjoy thinking through things, so I chose endocrinology.
Excellent. And you started off saying it's a kind of a well of hormones. So We talked, because when I was in high school, I didn't know what diabetes was. So we talked earlier about what diabetes was. Can you explain the difference between a type 1 diabetic and a type 2 diabetic for the team?
Absolutely. So we think there are many different types of diabetes in addition to type 1 and type 2. But the main difference between type 1 versus type 2 is that type 1 is an autoimmune process where patients lose the ability to produce insulin on their own. And then type 2 is more of the inability to respond to insulin. So oftentimes type 2s are associated with other things like hypertension, increased weight, that kind of thing. So generally we can use those two things to differentiate type 1 versus type 2. And of course you would hear about family history. So in type 1, they could also have family history. For example, a dad who has a type 1 diabetes, then that will increase the risk of having the kids having diabetes if they have kids. Versus in type 2, actually there's more extensive family history with type 2, and the offsprings eventually develop type 2.
I'm going to help them get this out of this door from this way. Perfect. Oh, you got it? Okay. So what has been, what's been, you feel, most rewarding for helping people improve their diabetes?
So the most rewarding thing is it's a process where you can, it's a disease you can eventually achieve what the patient and you come together and decide to achieve. So they will be able to control their sugar eventually in most cases. So we can definitely see good outcomes, and that's definitely very rewarding compared to when I go through my medical training in med school and residency as well. I did rotate through different specialties, including oncology. Oncologists are doing great things, absolutely, but for me, as I see those oncology patients, at times can get pretty depressed. So part of the, to answer Dr. Flower's question, part of the reason why I think seeing my endocrine patients are rewarding is that, one, I do get to establish long-term relationship with them, and second, together we were able to achieve some very positive outcomes. So that's definitely rewarding.
And one last question, because we talked a lot about teamwork here. Who are some, like you have a diabetic nurse that helps educate? Can you talk a little bit about how that helps your team for your patients?
Yes, absolutely. Yes, we were very fortunate to have a very good diabetes nursing team in our clinic. So oftentimes, our time as a provider with the patient is somewhat limited, and we rely on our nurses to provide education. And also, repetition is very helpful. We go through the education once, and having the nurse come back and educate once, they're going to remember more. Mm-hmm. So.
Excellent. So, can you guys help me thank Dr. Clark and Dr. Yang, who got patients to go to, and then Dr. Ramos are going to stay. Can we thank you guys so much for coming to stay? So thank you. Thank you. You're welcome to stay as long as you want to, but you're also okay. So, you met several physicians today, but this physician's probably been the longest in school than any of the rest of us because of his career. So, Dr. Ramos, can you tell us a little bit, answer the question?
Yeah, so I'm Vicente Ramos. I actually just finished my training. I want to take the opportunity to thank Dr. Clark for hiring me. I just started 4 months ago here. As Dr. Clark was mentioned, I'm a surgeon. I'm a surgical oncologist. So I did general surgery first, and then I did a fellowship in surgical oncology, which means I treat patients with cancer. I remove cancers pretty much from the patient's body. So what I do, I treat different types of cancers from going to the head to the toes, thyroid, parathyroid. Actually, I work with Dr. Yang a lot. I treat breast cancer and treat cancers pretty much of all the intra-abdominal organs, gastric, pancreas, liver, colon. I also treat cancers of the skin, like melanomas, and that's pretty much it. So for me, it was a little bit different. My career path. I'm originally from Mexico, so I actually didn't go to college. From high school, I went to med school, but it's a little bit longer over there. It's 6 years of med school, and after that, I did residency. So I did 5 years of general surgery residency, and then I did 2 years of fellowship. So yeah, usually it's about 7 years of training. Some people actually take some time off from residency and they do research, like cancer research most of the time. So it can go from 7 to 9 years. Yeah, so what I enjoy the most about the work I do is I like the problem-solving part of medicine, and I think in surgery especially is something that you can see very quickly. You take the patients to the OR with a problem, and then in a few days, that problem is completely resolved. So I'm a little impatient, so I think that's why I chose surgery. I just want to see results like almost right away. And I mean, also that implies that you have a lot of responsibility when you are in the OR, taking someone through general anesthesia, removing one of their organs. That can be stressful, but at the same time, it's a lot of fun. And I really enjoy seeing the results that my patients have. Sometimes, like we use different types of technology to do surgery. Sometimes we do laparoscopy. I don't know if you guys are familiar with any of this, but pretty much we operate using a monitor and long instruments. So we're just looking at the monitor and doing the surgery that way. And nowadays, actually, we have a robot. So we put the patient, we put the arms of the robot inside the patient's body, and we actually control it with a console. So sometimes it feels like you're playing a video game. So that can be a lot of fun. Yeah, actually, when I'm in the OR, sometimes I start a surgery at 7 a.m. and then all of a sudden it's 5 p.m. and I don't know, it's just like time flies when you're having fun. And what would I tell my younger self? I think what you guys are actually doing is great, that you spend the time to come to the hospital, get to know people, and yeah, try to expose yourself as much as you can to the different careers that are out there. I don't think I did that. I initially thought I was going to be an engineer. As I said, I like problem solving, but what drew my attention to medicine is like that 2 + 2 is not always 4 in medicine. So you have to take a lot of factors into consideration, and yeah, I think that's a lot of fun.
Excellent. Okay, thank you so much. So thank y'all.
Thank you so much.
Really appreciate it. And you can get back patients too.
Yes.
Thank y'all.
Thank you.
So when did you, obviously in Mexico you got a different pathway. So when did you first know you wanted to go to medical school?
Well, my dad is a physician and my mom is a nurse, so I was very exposed to medicine since I was very young. But actually, it's funny because I think probably it's not the greatest path like what we do in Mexico, because there's a lot of people that drop out in med school. Just because from high school you go to med school, you don't know what you're doing most of the times. Fortunately, it didn't happen to me. It seems like eventually I figured it out and I liked it. So I think it was until second or third year of med school that I actually knew what I was doing, and the reason that I was certain that that was the right decision. But I think, yeah, what drew me into surgery, I think it was one of my anatomy professors. He was a great surgeon, actually a surgical oncologist, and I just found it fascinating. We would go to the anatomy lab and see all the organs and all the connections and everything, yeah.
So that was your connection with surgery?
That was my connection,
Okay.
yeah.
Now, we got some of the folks, we got someone who wants to be a neurosurgeon, other ones want to be a pediatric surgeon, orthopedic surgeon. What made you choose the cancer pathway?
I think just when I started having my first patients, when I was still doing rotations in medical school, just seeing how rewarding it was seeing a patient after having a cancer surgery and tell them that they're cured. I think that was very rewarding. Patients are so grateful, and yeah, I wanted to be part of that.
Okay, now, what I want you to do is break down, because I don't know, when I was in high school, I knew what cancer meant. I knew it didn't sound good, it was not a good thing. Tell a little bit about what's the origin of cancer and some kind of in the background, what we know happens to folks.
Yeah. So there are many types of cancer, and every single cancer is different. And what cancer mean is like when cells are reproducing, like we have skin cells, for example. Those are the ones that that kind of like reproduce more rapidly. And you see how like your skin comes off sometimes. So what happens inside the cells, like there are some mutations in the genes that those cells start misbehaving and turn into something different. And that something different eventually can create a tumor. And that's pretty much what cancer is. Just cancer cells reproducing very rapidly out of control.
So did you hear that? That's what cancer cells is. They're out of control. And sometimes they maybe start in the breast, but then what happens to them? They go other places too.
Yeah, so that's one of the problems with cancer sometimes. They start with some tumor cells, sometimes we don't see them. Actually, most of people have cancer cells in their bodies, but we have a very good immune system that kills them. But sometimes the immune system doesn't recognize them and they start growing out of control. And sometimes they just start like a small tumor, let's say in the breast, but they can spread to other organs. They can go to the lungs, they can go to the brain, they can go to the bones. And at that point, most of those patients, they would not be able to be cured with surgery, but we have other medical specialties like medical oncology that they treat with chemotherapy. They just give drugs to try to kill these cancer cells. Or we also have radiation oncology, so they use radiation to try to kill these cancer cells as well.
So you've got your surgeons who treat cancer. You have a radiation oncologist who treats it with radiation beams. And you have a medical oncologist who treats it with chemotherapy. So all of these help to treat cancer, but different aspects of it. What's the importance of, we hear a lot now. Have you guys heard of Cologuard? You guys heard that on TV, the Cologuard commercials about screening for colon cancer? Why is it important for them to encourage their parents at a certain age and their grandparents to get their test done?
Yeah, actually I had to convince my parents to get their colonoscopy. Not a Cologuard, but a colonoscopy. So the thing is, colon cancer is very common, especially in the US. And the only way to to identify colon cancer early is by doing several screening tests. One of them is Cologuard, which pretty much detects blood in the stool. Colon cancer sometimes can present like that, like a small tumor that sheds off some blood in the stool, and that's how can you identify it. Because if people, they don't have their Cologuard or colonoscopy done whenever we recommend it, usually at 50 years old and then every 10 years, if they wait, sometimes it might be too late. They start having let's say some belly pain, and maybe by the time we detect colon cancer, it might be too late. It might already gone somewhere else, other organs. And so that's why it's very important to do this screening with Cologuard or colonoscopy. So if there's a cancer, we can detect it early.
Okay. Have you guys ever heard the term metastatic? Metastatic cancer. There's a cancer, when it becomes metastatic, it means it spread from where it started to other organs. So it's important because the earlier you catch it, the higher likelihood to cure it than having it stay in the body and spread from the colon to the liver or to the brain. As Dr. Ramos said, then surgery is not the answer. Then you have to go to the chemotherapy. And people respond differently to chemotherapy. Chemotherapy is poison we put in the brain, right?
Yeah.
And in the body, but it helps to kind of heal that. So what do you enjoy most about being in the operating room? And describe an operating room to folks who've never been in an operating room.
Yeah, so
What's an operating room?
An operating room is just like this room pretty much. You have a lot of machines. You have the machine that the anesthesiologists use to give patients general anesthesia. You have a bunch of tools. So usually you have a table in the middle. That's where the patient is going to be laying down. And then, as I said, there's different ways you can do surgery. like the traditional way, you just make cuts with the knife, but you also have other tools like minimally invasive surgery, laparoscopy, and robotic surgery. And you start your surgery. The patient's completely asleep, they're not feeling anything, they don't have any pain, they're not suffering. And I think what I like the most about surgery is that you have to make decisions. So what's the next step? What I'm gonna do next? Is the patient bleeding? Okay, I have to stop it. And so you have to have good medical knowledge. What happens if I remove this organ? That's not compatible with life, so I cannot do that. You have to have some dexterity. So I like to think it about a sport. In order to gain that dexterity, you need experience. So you have to do these procedures many times. That's why training is so long. People have to make sure that you're good to do the surgery on your own. So that's another skill that you develop. Like you play sports, repetition. You have to do a lot of repetition. And at the end of the day, I think it's just like solving a problem. I think that's what I enjoy the most.
Excellent. We have, one of the students in here is thinking about becoming an anesthesiologist. What's your partnership with an anesthesiologist?
Yeah, so we work with anesthesiologists every time we take someone to the operating room. You want to be an anesthesiologist? Yeah, so it's a very close communication with them because we really depend on them to maintain our patient vital signs like their heart rate, their blood pressure, as normal as they can so we can perform the surgery. Before we had anesthesiologists, I would say like a lot of patients died on the table just because we didn't have that specialist that control all the vital signs of our patients. So yeah, we're in close communication all the time. If I'm getting into a lot of bleeding, I tell my anesthesiologist, you know what, I'm in trouble here. I need you to do something. Either give him like some medications to keep their blood pressure up, give him blood and stuff like that. So yeah, it's a very close partnership.
Perfect. Any questions for Dr. Ramos before we thank him and tell him goodbye? Anybody with any questions? Thank you, Dr.
Thank you. So I'm going to ask Livy, I want to show the video that you saw when you first came in here. It's only 2.5 minutes. I want you to see it. You saw it early before you got in. You're thinking, where am I? And I want you to watch it again as you kind of heard the day of the partnership. See if it might have a little more emphasis for you, okay?